Hello, so today we're going to talk about how to use a COVID antigen test kit. We're going to go through the steps that you need to do to get an accurate result. So first and foremost, we're going to go through what we got. We have our packet here of the COVID-19 antigen test, okay? You'll have a specimen. This is kind of where this is the solution that you'll use to test with. And then of course you have your nasal swab. All right, most of the Thai FDA approved packets will include this. It has a little tabs that will go on top of this, which will collect your specimen. All right, you can also use it to hold your specimen bottle like that. All right, it's important that you check there's an expiration date, so you want to make sure that it's not expired. This one expires in 2023, if you can see closely there. So what we're going to go about doing, I'm just going to open it. What you'll notice inside is the kit part that will actually read the specimen, okay? And we're gonna drop our specimen onto this little guy. You'll have a little bit. This is just for the desiccant to keep it dry in the packaging. All right. So we're prepared to start with our test. All right, so what you're gonna wanna do is get your nasal swab ready. What I'm gonna do is, you can see that this thing has a little top on it. We're gonna pull that top back to open the specimen. And then we have a little pocket that I have there. You can measure your swab, so you're going to go straight back into the nose. A good way estimate is if you look at and see how far it goes to your beginning part of your ear. Important thing to know as a ear, nose, and throat doctor is that you just want to go straight back. All right, it's not going to feel that pleasant, but we're going to go ahead and start. You can keep your head straight. I'm going to stick it all the way in. All right, then I rubbed it around, 2 or 3 times in the back of my nose. Now what I'm gonna do is, you can see here, I'm gonna swirl it around here. All right, and then what you wanna do after you're done swirling it around, is you wanna squeeze it to get a good, accurate specimen from your swab. I'm gonna stick the swab away, and we'll be done with that. You have your cap here, right? You're gonna stick that cap on top. So the good thing about it, so the cap is gonna allow you to squeeze the specimen out of here. All right. And then what you're gonna do is, you can see C is for control. T is the test, all right? So you need the control to come up with a mark. And what you're gonna do is, you're gonna put 4 drops in this little specimen area there, and it just squeezes like a droplet. So 1, 2, 3, 4, all right? And then what you're gonna do is, you're gonna time it for 15 to 20 minutes, and then come back and check it out. So now that 15 minutes is up, you can wait 15 minutes, 20 minutes. But you can see here, the C is the control. So that means that you did the test correctly. So you can be confident in the results. And then the T would appear, obviously, if you test positive. If the T does not appear, a line does not appear there, then that means that you test negative. After that, what you can do is usually most hospitals will have a QR code that you can scan and submit your results, and that way you can, especially if you don't really have symptoms, you can consider home isolation and have a physician follow you while you self-isolate and quarantine at home. So thanks for listening with us, and hope everyone stays safe.